Samantha Willis. I am a board-certified counselor from the state of Alabama. I specialize in trauma, in LGBTQ plus issues, specifically transgender issues, and I also am a kink aware professional. So today we're going to be talking about trauma and how it affects your brain, mind, and your body. We're also going to be talking about ways to cope with trauma and to help others cope with trauma as well. So let's start by talking about what trauma is. Okay, so trauma is the result of an event that overwhelms the central nervous system, and it can change the way a person remembers and reacts to the memory of a traumatic event. So these changes cause a person to be incapable of incorporating the traumatic memory into their daily life. And it's not the story of something that happened in the past, but it's really the current imprint on your life. It's the hurt, the terror, the dread of what happened. And it's important to note that every story is different. So two people might have had a very similar experience or even experienced the same thing, but their bodies are going to experience them in different ways. And so it's really important to note that every person is different. You can take identical twins and they're going to process that traumatic memory in a different way, and that traumatic event in a different way. And while one person might have certain symptoms, another person might have none, because it depends on our brain chemistry and how we process that. So I want to kind of touch on complex trauma. So complex trauma is when more than one traumatic event happens. This is something I see more frequently in my practice. And it often is accompanied by an environment not being responsive to whatever that traumatic event was for you. So that kind of exacerbates the symptoms you might be having when you didn't have a responsive environment. So there are all different types of trauma. Trauma comes in so many forms, from domestic violence in your household, physical abuse, sexual abuse, spiritual abuse, rape. So many different forms of trauma exist. And we are triggered in different ways when this happens. So a trigger happens when a stimulus retrieves a traumatic memory. So a trigger can come in the form of a sound, of a smell, of bodily feeling, of a place, a thought, a particular movement, a tone of voice, or an emotion. And this can cause things like sadness, panic, flashbacks, dissociation, pain, or physical somatic symptoms to occur. So this could come in the form of shaking, feeling dizzy, fatigue, feeling sick to your stomach. And this can trigger the fight, flight, or freeze response. Now, it's important to note that these responses to trauma are similar to reflexes we have in our bodies. They're not deliberate or planned. And so sometimes what happens when we're triggered is we become dissociated. So what's dissociation? It's losing a sense of presence, resulting in disconnection between thoughts, memories, surroundings, and actions. So it comes in, I really say, three major forms of dissociation that I see on a regular basis. There's depersonalization, which is when it feels like it's not happening to you, when it's when things become dreamlike. Derealization, when you don't think reality is real. And then there's dissociative amnesia. It's your inability to recall personal information about yourself or a particular time in your life. And sometimes when you're dissociating, you don't recognize it. So it's important to start becoming aware of that, and maybe those who are around you becoming aware of it when they might notice you being spaced out or something like that. So we have different types of memories. We have two major types of memories. We have implicit memories, which are unconscious memories that are remembered through the five senses. So implicit memories are memories that start really pre-birth, and they're not verbal. but we continue having them throughout our lives. An example would be you smell something and you feel a particular way, and it triggers a particular visual memory for you. It's not verbal. You can't, definitively say that this was part of trauma or otherwise. A great example, I think, would be, let's say there's a small child who cannot talk yet, so doesn't have any explicit memories at all, and they are in a war zone. So they're living in a war zone. They move out before they start talking, before they start having those explicit memories, maybe before age 2, really when those really kick in. And later in life, they might hear a loud noise and they might kind of curl up in a ball or something like that. That is a trigger response from an implicit memory. It's very real, and it is something you remember just on a nonverbal level. And then we have explicit memories, which are conscious and intentional memories. We all know what those are. Those are just our normal working memories. And then sometimes we have flashbacks. It feels like you're being drawn back into a traumatic experience, and it feels like it's still happening, or maybe that it's happening again. And flashbacks aren't just, what you would see on TV being a flashback. That's not really a good representation for everyone. Flashbacks can come back in the form of pictures, of sounds, of smells, of bodily sensations, feelings, or lack of feelings. And it's important to note that you can get these because of a particular feeling you have. Maybe someone touched you in a particular place and you don't know why. Maybe it's an implicit response reaction to it. And then you have a flashback. And you just have a feeling of fear all of a sudden, and you don't know why you're scared. That's what might happen with a flashback. And we are going to talk about things you can do for one another toward the end of the presentation. Okay, so let's talk about what happens to the brain when trauma happens. Okay, so the brainstem has disturbances. So that could be arousal, sleep problems, wake problems, hunger, breathing difficulties, chemical imbalances, all those things are affected by the brainstem disturbances. And then you have your limbic brain, which is also called the emotional brain. So in particular, the amygdala. So that's right here, and it activates the amygdala, and it triggers a cascade of stress hormones throughout your whole body. And so that's why you might have your heart rate driven up if you get upset about something. That's your amygdala kicking in. Your oxygen levels and blood pressure change. And so, like if you're having a panic attack, that would be your amygdala being activated. And that's when, breathing exercises would come into a lot of use to regulate your oxygen and carbon dioxide levels. So I'd really recommend diaphragm breathing in those cases. And then you have prefrontal cortex, which is vulnerable to going offline in response to real or even perceived threats. So this could cause you to do embarrassing or hurtful things to yourself or to someone else. Let's talk a little bit about the nervous system. And with that, physiological reactions to trauma can result in physical illness. So there has been, this hypothesis for many years that trauma is connected to physical illness, but it is part of science now. That's something we know now, that it absolutely is. It can trigger things and cause things that are physical. And I'm not saying if you have one of these things, it's caused by trauma, but the correlation is very well-founded. We know that people who have fibromyalgia have a very high chance of having had traumatic events happen to them. Same thing with chronic fatigue, thyroid disease, GI issues, asthma, autoimmune diseases. You're much more likely to have these things if you have had trauma. in your life. And, there are a lot of different symptoms of trauma. So, some of the ones I see most often are mood swings, addictions, aggressions, anger, anhedonia, which is not enjoying things that you used to enjoy, anxiety, attachment, avoidance, blame of self or others, blocked or repressed memories, depression, difficulty concentrating, dissociation, exaggerated startle response, fatigue, fear of being touched, or maybe just in a particular place, feeling isolated, flashbacks, intrusive thoughts, forgetfulness, hypervigilance, the inability to make decisions. Interpersonal difficulties is one I absolutely see all the time. Intrusive thoughts, irritability, loss of sustaining belief. So that could be spirituality, religiosity, interpersonal skills, low self-worth, or worth depending on one aspect of yourself, such as you feel like you're just good for sex, or you're just good to provide income to your partner. Nightmares, panic attacks, risky behaviors, self-destructive behavior, self-harming behavior, sensitivity to sound or light, feeling shame and guilt, suicidality. So that could be suicidal ideations, suicide attempts, just suicidal thoughts, and trauma-related reminders. And those are just really a few of the symptoms that I see on a daily basis. And I often see also how it comes into play, how sex is an issue with people who have had trauma. So sex is natural and normal, it's great. But many people who have had trauma have difficulties with sex. So even if you might be physically safe, in your mind you're not. And so it might be one of those things when I was talking about triggers, and there could be a trigger and you could not even be able to identify it. And so in this case, I'd recommend safe words and to look for signs, to kind of do a little investigative work. What is causing this issue when you're intimate with somebody? And to try to figure out, okay, what kind of touches this is causing this? What, where in my body is this coming from? And just kind of identifying what is causing that so you can avoid whatever that is in the future. And, hopefully that's something I've seen where definitely that kind of thing can diminish over time, where maybe something that used to cause a big trigger response doesn't anymore when someone starts processing their trauma. So preparing for triggers is important. Okay, so here are 4 things you can do when you're preparing for triggers. Okay, so the first thing is to try to anticipate the triggers and prepare for them. Second thing is to pay attention to body signals. So, when you feel triggered, what happens to your body? Do your hands shake, or does your stomach hurt? What's happening to your body? The next thing is coping skills. Yeah, kick in with those coping skills. Do what you need to do as far as coping skills are concerned. And ground yourself in the present. Be present and use whatever skills necessary to do that, whether it's mindfulness, meditation, to pull yourself back to reality. I'd recommend doing something like being able to name 5 things that you're looking at, seeing, hearing, if you're tasting anything, to just kind of focus on those things to bring yourself back to the present. So coping skills, there are so many coping skills, and it's really different for every person what works for them. I'm always going to recommend diaphragm breathing, which is where you breathe in deeply into your diaphragm. And so you breathe in, you hold it, and then you exhale slower than you breathed in. And you can really feel it if you put one hand on your abdomen, the other hand on your chest, and you can see which hand goes up and down more. You want the hand on the bottom to go up and down more because you're breathing to your diaphragm. As we age from teenagers into adulthood, we start breathing more shallowly. And so just check yourself on a regular basis if you're breathing deeply enough, because that can regulate your oxygen, carbon dioxide levels. Another thing that really helps with trauma are right hemisphere activities. So that would be art, journaling, meditation, mindfulness activities. Those are some of the coping skills that I really find the most effective for my clients. I will have put a caveat out there that sometimes journaling is not positive for some people because it can bring up too many memories. And so sometimes journaling or writing trauma narratives without a clinician's assistance is unsafe. And so you really just have to know yourself to know if journaling is a positive thing for you or not. But, definitely find things that work for you, things that make you feel better, and listen to what your body is telling you of what works for you and your way of life. Okay, and the final thing that I want to touch on is how you can help other people. Okay, so if you know someone or you work with someone who has had a traumatic experience, it can be really difficult to try to figure out ways to help them. So here's a little guideline of how you can do that. Allow control or choices if at all possible. Because the last thing someone who has had trauma needs is any kind of choice or control taken away from them. The next thing is to avoid unwanted physical touch. So if someone is showing signs that they do not want to be touched, just stop what you're doing, and when they say they're ready, then ask for consent before you touch them. And that's when, like safe words and things like that come into play. But sometimes someone is so distraught that they cannot even think of their safe word to say, because they're in that fight, flight, or freeze response. And so that's when you need to really be able to watch their body language, watch what they're doing, and kind of be able to identify what those triggers are. The next thing is to just be consistent with whatever you're doing, whatever your role with this person is. Be consistent. Be patient with them. Don't get overly irritated if they need to take a lot of breaks or anything like that. Be predictable with your behavior so they know what to expect from you. And don't take their behavior personally. If there's some kind of trigger response that you're getting from this person, it's probably not about you. It's probably about them and their past. And the next thing I'd say is encourage self-worth and guide deep breathing. Just sit there and help guide them. Breathe in and just kind of like count it out yourself and make sure that they're taking enough deep breaths. And, listen to what they're trying to tell you, because that's something that I've heard from people can be really frustrating, is that they don't feel heard. And really the final thing I'll say on this matter is to respond and not react. If you react really strongly to somebody who is having trauma symptoms, then that's going to make them go even further with, whatever kind of extreme emotions they're feeling. So I'd say respond and not react. Okay, so I hope that you learned something today, learning about trauma and ways that you can help other people who have experienced trauma and things that you can do for yourself. And, really, I want to say that there is hope. If you've had trauma happen to you, healing can happen. It takes time. It takes a lot of work. Sometimes things get worse before they get better. But I've had so many clients who have been able to move forward with their lives. And it's all a part of it. It's all about putting the work in and being with a clinician you trust and you feel will be able to help join you on your journey. So thank you so much for watching. And I enjoyed being here today. Bye.